Hi guys, welcome to HealthSpectra.com.
Colon cancer, everything you need to know. Have you been recently encountering issues with your stomach? Sudden sharp shooting pain is often a very common phenomenon that we do encounter every once in a while, that we end up taking for granted. While it could be nothing, it could also be something as serious as colon cancer. What is colon cancer? Colon cancer is the growth of cancerous cells in the large intestine, especially in the colon, which is the last part of our gastrointestinal tract. It is often hard to detect in the early stage, because majority of the people take the symptoms as something trivial, and not as seriously as it should be taken. What are stages of colon cancer? When it does come down to discussing the common stages of colon cancer, the same can be distinguished into 4 different stages, depending on the severity of the condition. The stages predominantly start with the initial formation of the polyps, which deteriorate to formation of the cancerous cells which infiltrate the cells of the colon. What are the types of colon cancer? Next on the list of discussion are the types of colon cancer. Predominantly, Adenocarcinomas is the primary type that affects 96% of the patients. The other rare forms of colon cancer include the ones that stem from lymphomas, carcinoids, sarcomas and gastrointestinal stromal tumours. What are the causes of colon cancer? Owing to the fact that we are all engaged with a very hectic schedule, there are a number of things we are doing wrong on a daily basis that could end up being a contributing factor to the development of colon cancer in the body. Let us take a look at some of the common causes, shall we? Age. You might not realize this, but the Centers for Disease Control and Prevention does suggest that over 90% of the cases surrounding the colon cancer have been found to be in people over 50 years of age. It is thus indicative of the fact that you are at higher risks of developing colon cancer the more you age. Precancerous growth. The accumulation of the precancerous growth in the lining of the colon is often commonly witnessed as the first stage of the colon cancer development. These are often termed as polyps and are nothing but small and benign growths in the lining of the colon. If left untreated, it can lead to growth of cancer in the colon. Genetic damage. Another cause behind colon cancer is any form of genetic damage and issues that could be contributing to the development of the colon cancer symptoms. The uncontrolled cell growth can actually be because of any form of genetic issue, which can affect the DNA to end up contributing to the uncontrolled cell division. Obesity. Statistics suggest that obese people are a 30% heightened risk of developing colon cancer in them. Studies do suggest that managing and handling the condition associated with obesity and being overweight can effectively help in protecting the body from developing colon cancer. Type 2 diabetes. It is always best suggested to keep monitoring the condition of your diabetes, as well as the signs of colon cancer development. Several conducted studies have successfully confirmed the prognosis behind type 2 diabetes being a potential cause behind the development of colon cancer. Lifestyle and eating habits. It is always best suggested to keep monitoring the condition of your diabetes, as well as the signs of colon cancer development. Several conducted studies have successfully confirmed the prognosis behind type 2 diabetes being a potential cause behind the development of colon cancer. What are the symptoms of colon cancer? Colon cancer is often characterized by the sharp shooting pains that people feel in their abdominal region. Some of the other common symptoms that have been noticed along include rectal bleeding, irregular bowel movement, abdominal discomfort, fatigue and weakness. How to diagnose colon cancer. If you are reaching out to a doctor with the complaints concerning the problems around, they will predominantly suggest some blood tests, colonoscopy, X-ray or even a CT scan, depending on what kind of severity they think the condition is in. Don't take the symptoms casually. One of the worst things that people tend to do is take the symptoms casually. While this might not necessarily seem like a lot, it does have quite a lot of impact on the overall health that you can't even decipher.
Join our WhatsApp subscription for latest health articles delivered right to your mobile devices. Thanks for watching. Don't forget to like and subscribe to keep yourself updated.